Okay. Hi, everyone. Sorry, we're a bit delayed. There were some glitches with going live on Facebook. I'm so happy today to have Dr. Rabbanie Tariq as a guest. Dr. Rabbanie is a lifestyle medicine physician from Kashmir and is actively involved in inculcating the principles of lifestyle medicine within the country as well as globally, and has helped set up a number of lifestyle medicine hybrid clinics. He's also on the faculty of the European Lifestyle Medicine Congress and an associate of the CWGs of ACLM, being on an external monitor of the WHO. He works as a public health and preventive medicine advisor and heading the Infodemic management team at the Divisional Covid Control Room. Actively involved in research related to public health policy and making lifestyle medicine, has authored more than 70 publications, which include areas of lifestyle medicine, technology, NCDs and its risk factors, infectious diseases, epidemiology, sleep, stress, etc. He's also a part of the editorial board of an array of journals. Welcome, Rabbanie. So glad to have you.
Thank you. Thanks for having me here.
So let's just start with a very, very simple question, Rabbanie. How did lifestyle medicine begin and how has it spread all over the world?
As for the word lifestyle medicine goes and the new things happening with this branch of medicine, it appears that it just started recently, maybe a decade ago or something like that. But as far as in the history goes, the lifestyle medicine term was first coined around in 1980s by James Rippey. And since then, things are evolving on this concept. It went to one side on the preventive medicine side, then it evolved in terms of lifestyle diseases as the lifestyle of people evolved. The change from sedentary habits moved on to moderate and so on and so forth. So this actually led to the advent of lifestyle medicine with the increase of westernization of cultures, more easygoing of lives and all. So this is how it evolved, and with the advent, it started in getting some people together by the firm of American College of Lifestyle Medicine. It started over there in the western side in the United States, and it has moved globally all over the place right now. And we have a number of organizations coming up to advocate lifestyle medicine cause. For example, there is the European Lifestyle Medicine Council, there is Australian Society of Lifestyle Medicine, and then there's this Lifestyle Medicine Global Alliance, the umbrella which unites all these sister organizations. So the main theme actually hitting the root cause of these non-communicable diseases, the chronic diseases, which are actually the major chunk of morbidity, the mortality, as well as the dailies.
Yeah.
So that's how actually the lifestyle medicine concept started to evolve.
So how is it, there are other forms of medicine like integrative and functional and like you said, preventive. Can you tell us the difference between LM and the others?
Yes, of course. See, with respect to the functional medicine, conventional medicine, the integrative medicine, these are somehow, there's a very gray area and it appears there's a thin line in order to differentiate them. But the functional medicine, it mostly focuses on the exercise part only, that people are motivated, they're being educated, they're being counseled with respect to performing of exercises, taking care of the cellular metabolism and all. So that's focused only in a particular domain. Then comes this integrative medicine, which is somehow overlap between the allopathic side of medicine dealing with lifestyle diseases as well as others. For example, we have the conventional medicines, the therapies, the home therapies, the home remedies. There is the conventional like yoga is there and all. So the herbal side, the Indian systems of medicine. So integrative medicine in all is that clubs all these medicines. But for lifestyle medicine is purely allopathic side, which deals with patients, which deals with healthy people also in terms of promotion of healthy lifestyle, health promotion, and focuses on the aspects of allopathic side of management of lifestyle diseases. For example, hypertension is there, diabetes is there, and the modalities we have, for example, those lifestyle medicine prescriptions As for example, the physical activity prescriptions, which are even quantified these days in terms of use of electronic gadgets. Then we have nutrition prescriptions. As in side of preventive medicine, preventive medicine is also obviously, I'll say that lifestyle medicine is a subset of preventive medicine, but preventive medicine does not only focus on chronic diseases, it has lots of preventive measures involved with the ergonomics, with the occupational hazards, with the environmental issues and all. So that's a more broader, holistic concept, but lifestyle diseases focuses straight away more towards non-communicable diseases. Having said that, not specifically only non-communicable, but obviously the other diseases like communicable disease and all, in which lifestyle can actually play an active part in their control, in their prevention, as well as their management.
Yeah. So do you want to say a little about COVID and how it is related to lifestyle, since you're actively involved with COVID?
Yes, of course. We actually, whenever we found out that this transmission and the transmission of the virus and all, and how to break the chains and all, it is obviously somehow connected to the lifestyle in practice. When people interact with each other, how do they live in a society? How do they live in their social bubble and all? So everything is connected. So in terms of lifestyle, if people do not follow the lifestyle that was being advised, that was being reflected to them for the last 7 to 8 months, that actually led to the transmission of this infectious disease. So again, the measures, the preventive measures that were being advocated, that are actually the part of the lifestyle. How do you live? Like we say that word, the contactless living. How do you move through an area? How do you interact with people? What is the minimum distance that you have to keep? What is the diet you have to take? How much of sleep you need to? What is the exercise that you need to follow? See, it is not only restricted to a particular moment of time, but it's all lifestyle, how you could actually prevent the occurrence and the transmission of this disease, as for example, COVID.
Yeah, and also, isn't it true, Rabbanie, that immunity, an individual's immunity plays a very strong role in the in how bad the disease is for an individual and whether you succumb to it, isn't it?
Yes.
I think immunity is obviously related to lifestyle.
Yes,
Again,
of course. Yes,
isn't
of
it?
course. As we one core competency of the lifestyle medicine is actually the nutrition part, the
Yeah,
stress factors, the
yeah,
physical activity. All these are interrelated, and they actually result in they have their effects on the immunity of a person. As
yeah,
for example, people who remain stressed, people
yeah,
who do not have a balanced diet, they do not take nutritious diet, and specifically that kind of nutritious diet which is especially required for immune
yeah.
system, then obviously it influences the outcome of immunity, the level of immunity that a person has. It definitely is all connected to the lifestyle medicine.
And have you found that during this time of COVID, people have become more conscious about lifestyle?
Yes, of course, they have. We've seen that people initially, although they were reluctant to bring on changes in their lifestyle and all, but
Yeah,
slowly they started adopting this. Okay, and then the behavior change set in, and then we could see the use of masks, for example, and then maintaining the physical distance, and then sticking and living within that social bubble and all. It's all part of lifestyle, and it always depends on the 5 phase approach that we have in lifestyle medicine, how to deal with people and how to counsel and motivate them so that they could follow the lifestyle as is being advocated.
yeah. And the other aspect of lifestyles that's connected with COVID, which you could elaborate on, is the obesity, isn't
Yeah.
it? We're finding that obesity, the higher the obesity, the higher the mortality and morbidity, and then of course all the other comorbidities like diabetes, hypertension, which are the non-communicable diseases,
Yes.
isn't it?
Yes.
So
Of course.
yeah,
Of
so
course.
even though COVID is a communicable disease, it's so closely related to other non-communicable diseases.
Diseases.
Yeah, and what do you think is the reason that India needs it? What are the statistics that tell us that India is in dire need of lifestyle medicine right now?
Not only India, I'll say it's the
Yeah,
whole world
globally.
that is in a dire need of lifestyle medicine these days. As for example, it said that like 68% of the mortality that's happening in the world, okay, annually, is basically because of the NCDs. It's directly or indirectly related to NCDs. Okay.
So that's
And
non-communicable disease.
yeah,
Yeah.
and in India alone, it's almost 60%. So we can understand that those 6 out of 10 deaths, okay? So that is actually happening or interrelated to non-communicable diseases. I
Yeah.
understand there in the global arena, there are a number of programs running for the sake of preventing and controlling of these non-communicable diseases. Even
Yeah.
in India, they're doing a fabulous work, but somehow these lifestyle diseases, these non-communicable diseases need a much more intensive approach to deal with, not
Yeah.
only in the preventive side, not only in the curative side, but it's some modality that clubs everything together. And it's not like the world has changed. It doesn't stay only like that. Please, you counsel your patient or you just communicate your patient that you need to change your level of activity, you need to walk more, or you need to change your diet and all. It has to be quantified. It has to be, as for example, the medicine prescriptions are being issued, same way lifestyle prescriptions need to be issued to patients,
Yeah.
because we have the technology to quantify it. We can tell patients, we can tell people how much is the minimum amount of physical activity in terms of movement. For example, 10,000 steps per day. Now,
Yeah.
we did not have a technology some time back to quantify that and tell the patient whether that person has actually walked this much.
Yeah.
Similarly, the inventory, the digital inventory log method of the diet, okay, the sleep patterns, they can be easily monitored. They can be easily documented using a simple mobile phone. So
Yeah.
all these things can be documented and then issued in terms of a prescription. And that actually helps that this is the amount of data that is inflown through the
Yeah.
gadgets we actually use in our day-to-day lives and will help and is actually helping in lifestyle prescriptions.
Yeah, yeah. And also, isn't there a difference between how the lifestyle medicine physician deals with the patient as opposed to, what we are used to, writing a prescription, sliding it across the table and the patient just follows it, as opposed to in lifestyle medicine. I mean, one of the skills that we are taught is to actually literally handhold and coach rather than just advise, which I
Yes,
think is slightly different from the traditional method of just prescribing something and expecting the patient to take
yes,
it, isn't
yes.
it?
Of course, of course. So
Yeah,
in lifestyle medicine, as I mentioned already, it's not just about like mentioning or advising people.
yeah,
It's about like assessing their status. What is their baseline? People come from different baselines. For
yeah,
example, some might be already motivated. Some might be in the pre-contemplation. Some might
yeah,
be in the contemplation. Some might be even into the preparation phase. So
yeah,
we assess that as per the lifestyle medicine protocols, and then accordingly we can arrange, we can assist, we can advise, and even give them solutions how actually they can follow this and persistently. So this is the goal of lifestyle medicine. It doesn't stick or it doesn't restrict itself to just issuing a prescription. It needs a
yeah,
persistent follow-up and
yeah.
sensitizing people, motivating them, counseling them, and making these lifestyle modifications actually possible in practice.
Yeah, yeah, and the follow-up. And the part that I really also appreciate about it is that there is an insistence that the physician's lifestyle is also very important. You have to walk the talk.
Yes, absolutely, absolutely.
Yeah,
So it can't be like if the doctor himself or herself doesn't follow the lifestyle, the healthy lifestyle.
yeah,
Obviously, anybody saying so about this and that you need to touch the stars and you need to touch the sky. It doesn't happen in practice.
yeah,
So that can only be possible if the physician, if the lifestyle medicine professional team,
yeah,
the coach and all, everyone they themselves follow that lifestyle. That's a
yeah.
very important uh, aspect of this that needs to be followed by the doctors themselves also.
Yeah, yeah. And what are the different specialties in allopathy that can use lifestyle medicine, Rabbanie?
See, I see a lifestyle medicine as a core connection between multiple branches of medicine. As for example, if we start from prevention at the level of primordial prevention, I think the social and preventive medicine side, the community medicine, also known as the public health and preventive medicine, that can play a pivotal role. Okay, and then they have this alignment of with respect to the non-communicable disease levels of prevention, then the nutrition part. Then the other side is the medicine, the internal medicine side, for example, with the medicinal side and all, because in lifestyle medicine we do not restrict specifically only to advices of lifestyle modifications. It's part and parcel that medicines as in drugs are also part of slowing down the progression of the disease. Okay,
Yeah. Yeah.
and the medicine side will come in also. Plus
Yeah.
there's stress management. For stress management, obviously there's the psychiatric domain, there's a psychological domain related to it, so that again comes in. And
Yeah.
then there are infectious diseases, and then the endocrinology side is there, which deals with already existing non-communicable diseases in terms of management of diseases with respect to an array of medicines, and they've also been doing a fabulous job. But with shared medical concept, with shared medical appointments, the different models that have been projected in the global platform with respect to the lifestyle medicine acceleration, with that, I think these multiple domains of the medicine side can club together, and this can actually get converted into practical models of practicing of lifestyle medicine.
So you're saying it's going to be like a collaborative effort between the
Yes,
specialty physician and the lifestyle medicine physician. So it's
yes,
not
yes,
a, yeah, it's not a substitute for, but it's a complement to um,
yes. The strategy to
allopathy.
deal with non-communicable diseases has to be changed. It's
Yeah.
not a one-in-one interaction, one-time interaction between the beneficiary and the physician. It
Yeah.
has to be a series of interactions, not
Yeah.
only with the physician, but with the other elite specialities. For example, the exercise physiologists are there. Then
Yeah.
there are the physiotherapists are there, the fitness practitioners are there, and the
Yeah.
lifestyle medicine physician and other branch. As for example, happens with other diseases also.
Yeah.
There are a number of times there's a gray area where number of specialities have to treat a particular disease. As for
Yeah.
example, with respect to diabetes, it doesn't stay only with the endocrinologist. It moves on to the neurologist side. It moves on to the cardiologist side. So it has to be dealt even to the nephrology side. So it has to be dealt in a multi-modal way, and that is the best solution how to deal in a holistic way to deal with diseases and further hitting the root cause of the disease.
Yeah. Yeah. So, how do you see this spreading in India and I mean, it's already spread globally, but how do
Yes.
you see it spreading in India, and what is your hope as the treasurer of the Indian Society of Lifestyle Medicine?
See, with respect to how is it spreading in the global platform as well as in India. With respect to in the global platform, I see them they're way ahead than us in India, for example, and they've been doing a remarkable job since last decade. The American College of Lifestyle, they have evolved a lot, and it's more easily acceptable to them.
Yeah.
But I'll say the urgent and the dire need falls in the diabetic capital of the world, as
Mhm.
we already know about that.
Mhm.
The global burden as well as the burden in our country. What is the
Mhm.
burden of disease of non-communicable disease, hypertension, diabetes, then chronic kidney disease, chronic lung disease, and all. With
Yeah.
that, we see that there is, as it has just started within the last 3 4 years in India, in terms of an organization and all, I see a vigorant approach, a vibrant approach from all sides. And as for example, we have seen that there are a number of people joining, not only physicians, the exercise physiologists, the physiotherapists, and all, and they've been so excited to be on board with the Indian Society of Lifestyle Medicine.
Yeah.
I hope things evolve quite fast, because it is actually the need of the population as well as the individuals, that how do they come out of these lifestyle diseases,
Yeah.
because India is on one side moving towards westernization, and with that we have a double-edged sword connected that's related to the lifestyle diseases. So
Yeah.
there's progression going on with an increased incidence as well as prevalence of non-communicable disease. So there's a wonderful scope, and there's obviously a dire need.
Dire need. Yeah. And how do you see other organizations? Who do you see getting involved with lifestyle medicine?
With lifestyle medicine, as I mentioned already, the domains of medicine that are obviously connected to this concept of lifestyle diseases. These
Yeah.
organizations, for example, the Endocrinology Society of India, I hope they also take this into account, and they understand how what kind of scope exactly this medicine has in helping them out to deal with patients. And
Yeah.
then there's the Indian Association of Preventive and Social Medicine. They also can have a link with respect to the clinical aspect of the levels of prevention, which in fact also involves the curative side while dealing with the diseases.
Yeah.
Then again, as I mentioned about the other aspects, for example, there is cardiology, there's nephrology and all. So they all.
Non-medical side, Rabbanie.
Yes, yes, yes. So I think these all organizations hopefully will sooner realize the importance of lifestyle medicine, and will surely have to be working collaboratively to take this mission forward.
Yeah. And do you see this as something that the government, and even lay people as advocates of lifestyle medicine,
Medicine,
do you see
yes.
that, there is a trend towards that? Do you
Yes, yes. See,
find that?
obviously, whenever populations confront some problems, for example, in this sense, is the burden of non-communicable disease. When you see every second or third person in your family, in your society, in your community having stuck up with any non-communicable disease, people start thinking about it. As now, it doesn't mean they will be always right, because some people get derailed, misdirected so much some other solutions which are not actually scientific and evidence based. As
Yeah.
for lifestyle medicine, it's purely an evidence based medicine and allopathic side of medicine. And
Yeah.
I see people are actually quite watchful about how things with respect to lifestyle medicine will evolve, and the trust will build up surely. It will take some time, and then they will obviously realize that this thing actually works, as has been evidence in our counter parts. For example, the sister organizations like American College of Lifestyle Medicine, the European side, the Australian side, and the other multiple organizations all over the globe.
Yeah. So do you see this as a paradigm shift in healthcare? And do you see this as something that's here to stay?
See, I'll not say exactly a full-blown paradigm shift, but yes, it doesn't restrict anymore to just advices in terms of lifestyle modifications. It is quantified, meticulous, it's clear, precise. As we say, the smart objectives of issuing of prescriptions, specific, measurable, attainable, relevant to that particular patient, and time-oriented. So
Yeah.
when it automatically converts to that, people are going to accept it. There's no other choice.
Yeah.
It doesn't
I think we lost Rabbanie. I think his connection has frozen. So, yeah, as Rabbanie was saying, this is something that is fairly new in India, but I think we're going in the right direction in terms of curing or managing preventing and managing lifestyle-related diseases. Surely there is a lot to be done in terms of getting more and more physicians involved, and this is going to happen because, like I said, it's not just the physicians who've been who've realized that this is the kind of direction that we need to go in. The lay people, a lot of the lay people have already started asking questions about what else can we do to be proactive about our own health. So, when you go to a physician, as medicine has been traditionally practiced, the patient is not really proactive in her management. She she often just takes a prescription and then is told to follow the instructions. And I think for much of the time, patients have been happy to do that. But I think the time has come where patients also want to be a little more proactive. They want to feel empowered about their health, and they want to feel that they are doing something in the right direction towards the improvement of their health. And this is where lifestyle medicine plays a very important role, where we as physicians we not only prescribe, like Rabbanie had explained, the prescription for exercise, prescription for diet, prescription for everything else like stress relief, how much to sleep and how to monitor the sleep, all of that is given. But it's also a hand-holding coaching kind of the coaching is implemented so that the patient is not left on her own until such a time that she is confident that she can carry on without the help of the physician. And also, like Rabbanie already mentioned, we have other people on board, such as registered dietitians, physiotherapists, life coaches, people who are become a part of the collaborative model of lifestyle medicine. So this is what we want to do, taking lifestyle medicine forward in India. And unfortunately, I think Rabbanie is still trying to get back, which I'm going to try and get him back. Log in again. And in the meantime, if anybody has questions on Facebook, you can always ask the questions. Hi, Rabbanie.
Yeah, I'm sorry. We had some power disconnection. I'm sorry for that.
No problem.
Yeah.
So I was just, explaining that the lifestyle medicine is something that not just physicians are asking for, but even lay people, they want to start feeling empowered about their health, where they participate actively in the healing process and also understand, I think, root cause of disease, because it does give people a sense of empowerment when they do that, rather
Yes.
than being handed a prescription and asked to follow and a list of tablets that they're supposed to swallow. So these kind of,
Yes.
I think that's slowly. Um, I wouldn't say it's not popular, but I would say that it's being questioned
Yes,
as
sir.
the ideal form of management.
Of
Is
course.
yeah. Yeah. So which is why I think lifestyle medicine definitely hold a very, very, very important place. And so what else, what the ancient traditions of in India, I mean, we have so many wonderful ancient traditions like
Yes.
Ayurveda, all of that. And how would you say that is different? Because they do have a lifestyle element in
Yes,
their
of
practice.
course.
So
Yes.
how do you differentiate that from what we are practicing today?
See, with respect to the conventional medicine that was being followed since ages, oh,
Mhm.
yes, definitely there is a background related to that. But
Mhm.
in terms of lifestyle medicine, we purely talk about the allopathic side, as I mentioned earlier, the scientific and purely evidence based. And now,
Mhm.
when we talk about evidence based medicine, it's all research based, it's all practice based. Whenever
Mhm.
things are being done, it's followed up, and then we have it as a documented proof, quantified in a smart way. And we do not say that the previous part of medicines, they do not have their significance. Of course, they also do have that, for example, in the Indian systems of medicine and all. But we have our own essence in terms of allopathic side. We quantify things, as I mentioned, with respect to the way of prescriptions. For example, we follow the fit principle, the frequency, the intensity, the time, and whichever modality is custom to a particular person. Again, for the nutrition, we follow the different principles, for example, the TAF principle and all. And that's how it evolves as per their dosages, as per the customization of the particular person. And the other part of medicines, they can be complementary also. They can run side by side. But this is purely allopathic, and we will continue to make it run in that direction.
Yeah, yeah. There's a question here, Rabbanie.
Yeah.
It says, how do we view thyroid in relation to lifestyle medicine?
See,
What is
with respect to the influence of in the human body, there is an influence of the activities we perform. Okay. and how the biochemical process respond to that. Now, having said that, it does not mean that we only mean to say the modifications are going to solve the problem, the lifestyle modifications. As I mentioned earlier also, it's a clubbing of the medicines as well as the lifestyle modifications. In terms of modifications, lifestyle medicine modifications, it talks about the nutritious, the diet that has to be followed in terms of hypothyroid patients and all. So we suggest that the patient should avoid the Brassica family. Now, again, to some school of thoughts in lifestyle medicine and now have started to evolve, and they say, even if it leads to inhibition of the thyroid production and all, but do people consume that much amount of the Brassica family? Is it that frequent that actually it will lead to such kind of thyroxine issues? So it's just one idea. Although the conventional way of thinking has always been that the Brassica family needs to be slowed down
Can
in
you
intake.
explain that, Rabbanie? Can you
Yeah.
explain? Yeah.
Pardon?
Can you explain the family so that people understand?
Yeah. I'm coming to that. With respect to the Brassica family, it's the cauliflower, the cabbages, and all. So we've been counseling and advising our patients that please reduce their intake or even do not take them at all. But
Yeah.
in now today, the science has evolved, and they say even if a person is taking, for example, per week or per month, how much are they willing to take? So
Yeah.
that concept has also evolved. And as I mentioned, it's the quantification.
Yeah.
We do not say it in vague terminology. Please don't do this, and please go on doing this. It's
Yeah.
quantified. For example, how many grams have to be taken. So
Yeah.
that is actually lifestyle. And then the other part, the modifications part. As for example, you must have encountered, and it's scientific based, that exercise leads to release of endorphins and all, and the catecholamines and all, and that actually helps in augmenting the thyroid hormones and all, affecting on the hypothalamus, the pituitary and all. So this is the cycle that works together with the modification as well as the use of drugs.
Yeah. Yeah. There was somebody who was asked about how do I get educated in lifestyle medicine? Please join the Indian Society of Lifestyle Medicine. I'll post the link on Facebook page itself. So you can join ISLM, and then you can take the exam, which is a board certification that's internationally recognized. This year the exam is virtual for obvious reasons. Next year, we're hoping that we will have the exam here in India, which will make it very convenient for physicians to take it. And or you could take it in any part of the world. I mean, Philippines, Manila, all of these places have the exams at regular intervals. So any physician who is interested, please let us know. Go to the Indian Society of Lifestyle Medicine. We have a Facebook page. We have a website. So you can register through the website, and you can always reach out even through the TFL page and ask us, and I can guide you how to go about it.
Yes.
So any other questions that are coming up, we can. Yeah, 1 second. Let me just.
Meanwhile, I'll mention about the IBLM exam. It's a preparatory exam. Even before attending the exam, you have to clear a certificate course with respect to lifestyle medicine core competencies. Or there are other sister organizations which have these certificate courses. After one passes and qualifies those certificate courses, there is case studies that have to be submitted with the International Board of Lifestyle Medicine or ACLM, and then on that's the eligibility criteria. They have to submit their case studies. They have to qualify the certificate exam. Thereafter, they sit in it's an MCQ based exam, as per there have been number of exams, the licensing exams in other parts of the world, and the questions are MCQ based on lifestyle medicine, depending on the certificate courses actually. And that after that qualification of that International Board of Lifestyle Medicine examination, people who qualify that are known as diplomates in through International Board of Lifestyle Medicine.
Yeah, and you do need your continuing credits every.
Yes.
We have to read articles and things like that in order to continue our credits.
Yes.
like Rabbanie said, it is an internationally recognized exam and a certification. Um, it is currently fairly expensive, but I find that people are very interested. A lot of the MBBS, in fact, I'm meeting a lot of young doctors who've just finished MBBS, and they seem to have taken an interest in alternate ways of treating. It's not really alternate, because this has been, how to manage lifestyle has been taught from the Hippocratic days. It's just that, like you said, it's been quantified now, and actually prescriptions, and they are actually, you can actually identify if the prescription is being followed, and so on and so forth. It's not just random advice. So there are doctors who are more doctors who are getting interested, which I'm very happy about. And we have currently, I think this time we have about, is it 13 people, Rabbanie, who are taking the exam? 11.
Yes.
Yeah,
And
13.
these sessions for them were going on for the last 2-3 months. They've been going on. Uh, I hope it has been a wonderful, studious, active group in terms of academic activity and all. We
Yes.
wish them good luck, and they also qualify the exam
I'm
soon and
sure
join.
they'll all pass. Yeah, yeah. I'm sure
Yes,
they'll all pass. And then join. There are very few of us right now, but we hope that there are going to be more and more physicians
definitely.
who will join. Yeah. So yeah, I think we've almost it's almost 50 minutes. If there are no other questions on Facebook, um, yeah. So yeah, there are no questions on Facebook.
Great.
So yeah. So Rabani, I think this is a way forward, like you said, and
Yeah,
there is a dire need for lifestyle medicine in India
absolutely.
and globally. And I think we're all going in the right direction. Of course, there's a long way to go, because
Definitely.
what are the hybrid? Can you tell us about the hybrid clinics that you've helped set up? That
Yes,
would.
with respect to the concept of this lifestyle medicine hybrid clinics, it is evolved even in the West, in the United States. What actually is there, it's about health clubs, fitness clubs, clubbed together with a lifestyle medicine physician. It's not only a fitness professional who actually helps people promote their lifestyle, their fitness targets and all, but a doctor is also there. A lifestyle medicine physician is also there, who
Yeah,
corroborates the other risk factors, the risk assessment, uh, and their evolution, how the exercise is going, quantifying them, putting up the scores, and
yeah,
changing the lifestyle medicine prescriptions as per their requirements. As I mentioned already, those people who must have gone through the lifestyle medicine approaches, the 5 phase approaches of assessing, arranging, and so on and so forth. So these modalities, these hybrid clinics, do
yeah,
not purely focus on just the fitness in
yeah,
terms of muscle mania and all. They deal with the holistic concept with a team of lifestyle medicine professionals. A physician is involved, an exercise physiologist is involved, the fitness professional is involved, and then even a physiotherapist may be there, and
yeah,
nutritionist, dietitian, and all. And it has been observed, it's scientifically proven that the advices that is being given to all of these array of experts, the fitness professional, the nutrition, the dietitian, and the other members. But once it's a physician who is recommending these advices, these suggestions, people are actually more motivated. They find it more reasonable, they find it more credible, authentic, and automatically it increases their motivation power. And things get converted more easily and more approachable. So
yeah,
that's the concept of these lifestyle medicine hybrid clinics. That's how they run. And we have observed actually people actually get more attracted to this. This increases the credibility of a particular fitness platform.
yeah,
I'll not only name them as gyms or like that. In layman's term, we can call them gyms, but there's a physician also involved who
yeah,
screens you and then issues you customized lifestyle medicine prescriptions,
yeah.
and helps you in getting stick to that lifestyle modifications.
Yeah. So maybe the studio that I have, the fitness studio that I have, is probably, you could kind of call it a hybrid clinic. I call it a lifestyle studio, So
Okay.
because I see the client and advise, and we do have other people like the trainer, etc. So these
Wonderful.
kind of models are likely to be more popular, I
Yes.
would imagine, as we go forward, because again, looking at it from a fitness perspective as well, I think there is a dire need for higher qualification for the trainers as well as the physiotherapists
Of
in
course.
order in order to manage not just healthy people, but the people with other comorbidities.
More mobilities. And
Yeah.
it has to be that interdisciplinary and intercorrelated. And
Yes.
that approach, that multimodal approach, which actually will help in alleviating the root cause of the disease.
Yeah. Yeah. So like I said, I think we are all going in the right direction, and which is very exciting. And
Yes, absolutely.
although lifestyle medicine is very new in India, we are very excited being on the executive committee of ISLM. We're very excited to take this forward, and we're hoping that more and more people come on board. Yeah.
Yes, absolutely, absolutely.
So
Looking forward.
thank you so much, Rabbanie, for we've almost an hour of this. So thank you so much for
Thank you.
spending
Thank you.
your time. And, we'll have more such conversations so we can kind of keep everybody involved and engaged with what we are doing in LM.
Definitely, definitely. Thanks
Yeah.
for having me here. Good
Thank you.
luck.
Thank you. Yeah. Thank you so much.
Take
Bye.
care.
Bye. I'll post the link to Rabbani's. If you can send me your link, Rabbani, I can post it in the
Sure.
TFL page. So if anybody, your Insta, uh, and of course the lifestyle medicine links as well, so that we
Yes.
can, the TFL and from the TFL page we can link it.
Okay.
Thank you
Great.
so much. Thank you.
Okay.
Bye bye.
Okay then. Take care. Bye bye.